What specific therapy techniques work in PTSD group settings? Imagine a room filled with people who understand what you're going through because they've experienced similar things. That sense of shared understanding can be incredibly powerful. In group settings, several evidence-based therapy techniques have proven effective for treating post-traumatic stress disorder. These approaches combine the strength of peer support with structured, proven methods to help reduce symptoms and improve daily functioning. One of the most supported methods is trauma-focused cognitive behavioral therapy in groups. This approach helps participants identify and challenge unhelpful thoughts related to their trauma. In a group, individuals can share their experiences and learn from others, which can make the process feel less isolating. The group setting encourages social support, which is vital because feeling connected can boost recovery. Studies show that group cognitive processing therapy can lead to significant reductions in trauma symptoms, similar to what is seen in individual therapy. Another key technique is prolonged exposure therapy adapted for groups. This involves gradually confronting trauma-related memories and situations that have been avoided. In a group, members share their experiences during exposure exercises, which can help normalize reactions and foster mutual support. The group environment allows participants to learn coping strategies from each other, making the process feel safer and more manageable. Research indicates that group prolonged exposure can effectively decrease PTSD symptoms and improve quality of life. Trauma-focused cognitive behavioral therapy is also used in groups, combining education about trauma, relaxation techniques, cognitive restructuring, and exposure. Before diving into exposure work, groups often focus on building skills to manage emotions and stress. This helps participants develop a toolkit for handling trauma-related distress and challenging distorted beliefs. Working together creates a sense of community, which can motivate individuals to stay engaged and committed to their recovery. Skills training and psychoeducation are common components of group therapy. These modules teach emotion regulation, stress management, and interpersonal skills. Learning these skills in a group setting not only helps with trauma symptoms but also improves social functioning. When people practice these skills together, they often feel less alone and more empowered to face their challenges. Supportive group elements are also valuable. While not a standalone treatment, supportive groups provide a safe space for sharing experiences and reducing feelings of shame. When combined with structured therapies, they can increase engagement and help participants feel validated and understood. The group environment normalizes trauma responses and fosters peer validation, which can be a powerful step toward healing. Practical aspects of group therapy include having 6 to 12 members to balance intimacy and diversity. Sessions typically run weekly for 8 to 16 weeks, guided by trained clinicians. Therapists carefully manage exposure exercises to prevent overwhelming participants, and homework assignments help reinforce skills and encourage real-world practice. The social aspect of group therapy offers normalization and validation, which are crucial for reducing stigma and shame. In summary, evidence-based group therapy techniques like trauma-focused cognitive processing therapy, prolonged exposure, and trauma-focused cognitive behavioral therapy are highly effective for treating PTSD. These methods combine trauma-specific interventions with the support of a community, leading to meaningful symptom reduction and better functioning. Incorporating skills training and psychoeducation enhances coping and emotional regulation, making recovery more achievable. Always remember, these therapies are most effective when delivered by trained professionals following established protocols. If you're considering group therapy for PTSD, consult with a healthcare provider to find the best approach for your individual needs.